Hey there team, welcome to the Personal Health Timeline. Probably one of the most important presentations that you're going to have to learn, which is the Personal Health Timeline. This would be good if you're a fitness person and you want to give a great tour. This is great for beginning of a PT assessment before you go across the workout. We're going to be going over the 9 questions, 3 diagrams, the average person fast, running someone's numbers, picking a schedule, and also creating that timeline with their numbers attached. So the first question is going to be, how'd you hear about us, right? I think that's pretty obvious. Next question is going to be looking for a membership for yourself or your family members. Really, we're just planting the first seed there. If they have a spouse or somebody that might be joining them in the gym, tell me about your workout history. We're looking for past gyms. We're seeing if they already have a plan. A lot of these questions we'll have asked on the phone already. Tell me about your job. Is it physically demanding, sedentary, or what do you do, where? This is a great way to get an idea not only of their income level, but it gives you a really good idea of what's already going on in their body, what kind of imbalances they may have. If they're sitting down a lot, they may have some posture issues. If they're a laborer, they probably have some imbalance issues. What are your fitness goals? Hey, you're trying to add muscle, you're trying to burn fat. You're gonna get a litany of different answers. Most people want to tone, firm, be healthy. Question number 6, what is your plan in the gym? Again, getting a little bit more detailed. Are you doing the weights? Are you doing the classes? Are you going to be dieting? What's sort of your plan? Question number 7, this is where we really start to shine. Do you have any injuries, aches, pains, medical conditions? This is where we're really going to be able to flex our knowledge, and hopefully somebody has some type of condition that they want to let us know. The way that you want to ask question 7 is, everybody has something that bothers them. What's yours? What ache do you have? What tightness do you have? What do we need to work on? Question 8, are these changes for an upcoming event or a lifestyle change? Again, we're trying to figure out if this is more of like a permanent get healthy thing, or if they have a wedding or some sort of event that is coming up that they're trying to get in shape by, because that would then become their X factor. Who will be supporting your efforts? Again, this is our first test just to see, hey, is there anybody that's against you coming to the gym? It's our first chance of really finding out if somebody else is the breadwinner in the family, or will be paying for their membership or paying for their training. Now, ideally, after question 7, when they give you any injuries, aches, pains, or medical conditions, we're going to go into our back pain demonstration. It's going to go something a little bit like this. Mr. Jones, Mrs. Jones, most people are left or they are right-handed. Because of that, they develop an imbalance on one side of their body. Maybe it was because of an injury, maybe it's because of that right and left-handedness. And because of that, those muscles get a lot bigger, stronger, and more dense on one side of the body. What that does to the spine is it puts pressure on the spine in one direction, actually causes the spine to bend and vertebrae to slip over. A lot of people, what they'll do to fix that pain is they'll go see a chiropractor, go see the masseuse, and obviously that's not a permanent fix to their pain. A real common condition that people come when they come to the knee is knee pain, right? The reason is because their quad muscle becomes extremely overactive because they're always moving forward. They're walking up the stairs, they're running, they're jogging, they're walking the dog. But what they aren't doing is hitting all these other muscles that surround the knee. The calf, the hamstring, the glute, the groin, and all of these things cause an inhibited muscle reaction, which put pressure on the top of the knee. Things that you want to look for is your knee clicking, pre-arthritis, having to take medication for inflamed or swollen or painful knees. The next, which is really, really common, is around 28% body fat. People begin to feel at risk or have high blood pressure. Again, that's the swelling of your veins and arteries that make it a little bit harder for your blood to travel through. Around 30% body fat, you begin to develop plaque-like and fatty deposits that actually develop and grow on the inside of your veins and arteries. And because of that, we have to be put on blood thinners, so there's that way your blood can fit through the smaller space. And around 32% body fat, we begin to feel at risk or have symptoms of diabetes. That first symptom is going to be limb numbness. You ever see those people that their hands and feet fall asleep often? The next symptom is going to be slower healing. And what that means is cuts, bruises last a little bit longer. The next thing is going to be blurry vision. And what that means is at night, it's a little bit harder to read signs, things are a little bit more hazy, halos will appear around certain lights, especially at the nighttime, and just in general, your vision is getting a little bit worse. The next symptom is frequent urination. That would cause somebody to have to wake up in the middle of the night to go pee, interrupt road trips, interrupt movies, even if their urine is painful. And for men, it'd be ED, which is one of the main conditions that happen, called erectile dysfunction. And then for women, it's called low libido, and this is the ability or desire to have sex. All of these things happen around that body fat percentage. The next thing we're gonna go is the average person fast. Our goal is not to change their diet yet. Our goal is to get them to admit that they're an average person. So if you look right here, we go to food, Mr. and Mrs. Jones, the average person, they're gonna eat about 3 meals a day. Are you a little bit different or are you the same? They're gonna say hopefully around the same. If they say they're different, just write down the number that they are, 2, 5, whatever it may be. The next is Mr. and Mrs. Jones. About half those meals the average person makes at home, and about half those meals they eat out in some capacity. Would you say you're about the same, about half your meals you eat at home? Perfect. So that means about 10 to 11 meals a week we're eating out in some capacity. The next is going to be alcohol. The average American has 4 to 7 drinks per week. Would you say you're average or a little bit more, a little bit less? Love it. Next is going to be stimulants. The average American has at least 2 stimulants every single day. What that is: caffeine, coffee, energy drinks, vitamins, pre-workout, usually one in the morning, one in the afternoon. I hope you're average. The next is the average person has at least 1 treat per day. That's like a little snack, chips, crackers, cookies, almonds, some sort of something that you snack on in the middle of the day. The average person has 3 desserts per week. Think cake, pie, ice cream, candy, things that you eat late at night. And the average person has at least 1 treat yourself moment per week, which is, hey, they're taking their lady out to the restaurant, they're going out with the guys to the bar, they're buying that video game, they're getting their hair done, they're getting that massage, they're watching that movie, they're taking the kids out to Disneyland. Would you admit at least once a week you're doing something along those lines? Great. Now, as you can see, we have a pretty good base nutrition here. Mr. Jones, Mrs. Jones, if I gave you a diet plan to help you get bigger, if I gave you a diet plan to help you lose some weight, would you be willing to cut back on maybe 50% of this diet? Would you be willing to adjust 50% of their diet? Now, if they say that they want to eat more because they're trying to get bigger, hey, is it okay if we were to increase your current grocery bill by over 50%? If they're trying to decrease weight, is it okay if we were to reduce these negative things that you're doing right now by about 50% if I gave you some alternative things to eat? The way that you're gonna finish this off is with support. You're gonna say something along the lines of, Mr. Jones, Mrs. Jones, be real with me. If you went home and you changed the groceries, you changed the cupboard, you're eating at restaurants less, do you have support at home that's gonna allow you to do this? Can you make these kinds of decisions? Perfect. Now, the next area we're going to go to is running the numbers. Let's just use a real base example here. Let's just say that our gentleman in front of us is 220 pounds. Let's say that he's around 25% body fat, which because we just took his body fat. And now we're going to pick his goal body fat. So his goal body fat percentage, let's just say he chose 12%, right in between 8 and 15. And that automatically will calculate once you put this into the computer, and we'll have a separate video on how to run someone's numbers. This will automatically calculate their goal weight. In this case, would be 175 pounds. So our gentleman has about 45 pounds of fat that he needs to lose. And then you're gonna ask the question, Mr. Jones, Mrs. Jones, have you ever seen someone lose a large amount of fat and not add muscle at the same time? They get saggy skin, they get stretch marks, it's not attractive. Do you want that? No, good. So what we wanna do is we wanna add about 10 pounds of muscle during the same time period that you're burning that fat. Now, based on your schedule and how frequently you're coming in, you can lose that fat at a certain rate and you can add that muscle at a certain rate. What is your schedule that you're looking to do? Okay, you're doing Mondays, Wednesdays, and Fridays, or whatever they end up putting. Are you doing mornings or afternoons? So let's say you're doing Monday mornings, Wednesday afternoons, Friday mornings. Love it. Now let's create a schedule, a timeline of how long it's gonna take to lose the 45 pounds of fat and add those 10 pounds of muscle. So let's talk about this. First, we go down the timeline right here and we see your base point. You're starting from where you currently are at your weight of 220. Now, if you just go on your own, you're gonna get a little bit better because you're going from nothing to something. But very quickly, because of not changing your workouts, because of not eating correctly, or just in general not doing the right things during your workout, your results will begin to plateau. Now, the average person, if they're plateauing in the results, they're not gonna keep their gym membership. The average person, when they quit the gym, they don't rejoin a new gym for 6 full months. Now, of course, are we in better shape or worse shape after 6 months of no gym? We're in worse shape, and we're a little bit older, so we're starting from our worst point. We try this process again, we get a little bit better, we plateau, and dang it, it's been a year. Is it safe to say this is not the path that we want to be on? Good. So what we're gonna do here differently at LA Fitness is we're gonna change things like your reps, your sets, your range of motion, the tempo, the speed, the type of workout you're doing, the training style, the trainer, and every single time that you come in, we're gonna continue to make it harder and more difficult so you continually advance throughout your program. Now, so that way we can make this real, we can lose about 1 pound of fat per week, and we can gain about 1 pound of muscle every 5 weeks. So after 1 month of changing all these different things and sticking with your person, you'll have lost about 4 pounds of fat and added about 1 pound of muscle. Are we there yet? No, of course not. Now after 4 months, we'll have lost about 20 pounds of fat and added about 4 pounds of muscle. Are we there yet? No, of course not. Now at 6 months, we're getting a lot closer. We've lost well above 24 pounds of fat and we've gained about 6 pounds of muscle. Really, really close to that goal. Now I have to warn you, around this day, you're gonna be very confident. You're gonna feel good, you'll have lost over 24 pounds of fat, you'll have added over 6 pounds of muscle, and a lot of people get cocky around this date and they stop continually mixing up their workouts. You need to make sure you continue to go for all 12 months so you add that 10 pounds of muscle. Very important that you get to that mark so you make a permanent change in your body. If we do that, make a permanent change in your body, think about it, ex-professional athletes in their 60s, 70s, 80s, they all look pretty good and they have kids who are magically good at sports. It's not a coincidence, they change their genetics. But if you only go for 6 months long, you're sort of creating what I call the high school trap. You ever notice high school athletes don't make a permanent change? Why? They go for about 6 months, they look good, they feel good, and then they stop. They take a week off, they take a month off, works crazy, and they stop prioritizing and changing their workouts, and they don't make that permanent change. Instead, you have to go for all 12 months where we're gonna lose well above that 50 pounds of fat and we'll have added over 10 pounds of muscle. So let me ask you, Mr. and Mrs. Jones, can you be here for the next year to keep mixing up your workouts this way? Good. Now, if I could help you with the program, maybe we could check in with you every now and then, we'd be able to assist with this. Let me ask you, have you ever thought about how many different workouts working out for the next 12 months at 3 times a week is? Well, Mr. Jones, that's 144 different workouts that you'd be doing. Again, if I were to help you maybe with once a week, twice a week, maybe we could have somebody trainer check in with you, would you be interested in getting some assistance for maybe some of those 144 different workouts that you have to do this year? Now you leaving, you going anywhere, you can do this? Love it. Glad that we have you for the next year.